Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Clinical features of endometriosis. The most common age group causing endometriosis is 25 to 35 years. Endometriosis is rarely seen in extremes of ages. Here, there is a triad of dysmenorrhea, adnexal mass, and infertility is seen. The most common symptom causing endometriosis is pain, followed by adnexal mass, followed by infertility. Pain here is mainly the secondary dysmenorrhea with chronic pelvic pain. Dyspareunia is seen if there is involvement of cul-de-sac, low back pain, and painful defecation is seen. In endometriosis, we see secondary dysmenorrhea. So, in secondary dysmenorrhea, the pain begins before the menstruation and it does not improve with blood flow and it may persist even after menstruation. The secondary dysmenorrhea pain is new onset, progressive. It is severe pain which is associated with dyspareunia or painful defecation. This suggests endometriosis. Severity of endometriosis does not correlate with the number and severity of the symptoms. The mechanism of pain in endometriosis. Actually, in endometriosis, the endometrial implants are active and these endometrial implants undergo cyclical changes leading to bleeding. So these endometrial implants undergo cyclical changes leading to bleeding in these places. And because of this there will be pain. The bleeding also results in fibrosis and adhesion. There is also increased prostaglandins is seen in these patients. Endometriotic areas also have more pain sensitive nerve endings are present in the endometriotic areas. Pain is related to the depth of the lesion. Severe pain is seen in deep infiltrating endometriosis, or if the depth is more than 5 millimeters, then severe pain is seen.
thank you and thank you for watching.